Hello and welcome to our DPI COVID-19 update, where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Hello, Minister. How are you?
I'm good.
Okay, so let's jump right into it. Last week, during the COVID-19 update, you would have made an appeal for cooperation from the residents of Maracaibo. Can you give us an update in Region 5 and say if there were any new developments in that particular area?
Well, we had a regional team that went back into Region 5 on Thursday. That team also consisted of the vice chairman of the region, the chairman of the region, and other officials of the region, along with the health personnel. And the health people stayed on for the weekend, and they were trying to get as much people as possible tested. Unfortunately, I think there are lots of mixed messages that are still floating around in the community, and therefore the health team was not able to do much testing because, again, residents did not fully cooperate with the team. We were only able to acquire about 17 tests, or we were able to do 17 tests, and that's quite unfortunate because for us to get a better understanding of what is happening at Maracaibo, we really need to get more people tested. We would be sending in some more health personnel, and hopefully they'll stay, instead of the doctor going in and coming out, we'll send someone in to stay in for maybe a couple of weeks until we have this situation under more control. The community itself, they have medics and other personnel, but we want to reinforce that by sending in some other persons to ensure that we are able to get people to do all the right things. But, you know, these measures don't work if people don't cooperate. And while the chairman was there, I think we got pledges from the people that they would be working more closely with us. But unfortunately, when the chairman left, we didn't get that type of cooperation. So I'm not sure why, but we'll have to keep working with people because that's the only way we'll resolve this. As of today, the cases in Maracaibo has gone up. So as you will recall, the last time we spoke, it was about 33. It's now about 44 cases that we have there. And the more testing we do, I think we'll find a number of other cases. So we really need their cooperation if we are going to be able to offer proper assistance to the community.
Okay, Minister, is there any other community or area that is currently being monitored that we're seeing spikes in?
Another area that is of concern and where we have seen a spike is in New Amsterdam. Currently we have 36 cases there, and again the health team in Region 6 has been monitoring this, and hopefully we'll soon see the cases start declining. But again, these things would take time, and we would have to also do the contact tracing of the persons who have been exposed to the persons who have already been diagnosed with COVID-19.
Okay, Minister. Now, we understand that construction would soon be completed for the COVID-19 facility in Region 2. Can you give a timeline of this project? Should it be completed and ready for use?
Well, this project is really a maternity home that we had constructed previously. And what we did was to retrofit it now for COVID-19 patients. So the project is complete. There are some minor things that ought to be done, but I guess by this week all of that would be finished. And we would commission it later in the week, and it can accommodate about 40 patients, at least 2 persons in a room. If we go for a single person per room, then it would be able to hold 20 patients. So that facility is complete, and it would come in very handy if we have a spike in escrow.
Okay, can you say what the cost was for the facility?
The retrofitting has cost about 12.5 million Guyana dollars.
Okay, Minister, and you said should there be a spike in Region 2 that would the facility would be able to accommodate these people, but what would be the other areas persons would be able to come from to use this facility?
Well, basically it would be persons from the coast, and in some cases we have seen on the Essequibo coast patients coming from Moruca. So this would be the catchment area that we're looking at.
Okay, thank you for that, Minister. Now I have a question from the Guyana Chronicle for you. So the ministry has begun preparation for the rollout of the COVID-19 vaccine. And while it was stated by us, the Department of Public Information, that the ministry has ordered new refrigerators for the storage of vaccines, in addition to expanding the physical space, where would the vaccine centers be located, and what is the estimated time frame for the completion of the project?
Well, the ministry currently have a network of facilities. So we have, in every region, we have a facility for cold chain, and that's where we have been storing our vaccines for a regular vaccination program or immunization program. Now, what we're doing currently is expanding the space that we have at these centers. And so by expanding it and adding new freezers, we'll add capacity, because this would be a new program when we start the immunization for COVID-19. So we need more space and we need more capacity to be able to store the doses. Because we still have not received a firm commitment from COVAX about the types of vaccines that we will be getting. But by and large, COVAX has been talking to all the countries, and they've been saying that probably you'll get a mix of vaccine, meaning that you can probably get some that are minus 70, maybe some that are at minus 20, and some that are 2 to 8 degrees. So bearing that in mind, your cold chain now would have to accommodate the spectrum of vaccines that would become available from COVAX. And that is what we have started to prepare for. So apart from expanding the physical space that we have, we also have to buy the freezers that would match minus 70 and minus 20 and 2 to 8 degrees. So we have ordered the minus 70 and minus 20, and those are on their way coming into Guyana. But sometimes the logistics of these things can be delayed. So we are hopeful that we can get them quite early, because we have put in that order since last year. Apart from that, the 2 to 8 degrees fridges and freezers, those are more available, and we have quite a lot in our system. But just to work for the COVID-19 vaccine, we'll be adding some more, just to ensure that we have adequate capacity. In addition to that, when we're removing vaccines from one point to another, you'll have to get special carriers, and so we have also ordered those as well. So in terms of getting ready, the physical area for storage of vaccines, those places is really going to be our existing sites where we have been storing vaccines in all the regions. So we are expanding those. And once we expand them, we'll be adding the freezers, and in some cases we have to provide generators to make sure that there isn't any blackout and so forth. Those contracts have already been awarded. Some of the construction have already started, and we are hopeful that it would finish maybe within 2 weeks. So outside of looking at the physical aspect of things, we also had to do what is called a national vaccine preparedness plan. And this is under the guidance of the WHO. So we have completed that document, which talks about every single aspect of rolling out of vaccines in Guyana. That document has been completed, and that has been the blueprint that we've been working with. Among the things that we have to do is not just the physical things, but training. We have completed the training manual. We have started training the trainers. A lot of that work has been completed. And now the trainers would be going out to the different regions and rolling out training to persons who would be involved in the immunization process at the regional level. Again, this is not anything new to many of the persons involved in the rollout of this vaccine campaign, because many of them have been involved in our current vaccination efforts. We have brought back a few retired persons who have a lot of experience in rolling out vaccines, and they too would be part of this process. The difference in the training would be explaining to people the types of vaccines that are available for COVID-19, the temperature requirements, if we're using, say, a Pfizer vaccine versus a Moderna vaccine, and the difference between the different types of vaccines, how they can be used, what temperature, so different things that would be necessary for these particular vaccines. But the people who we are working with are all experienced. They have done this before with other types of vaccines, so they're pretty much knowledgeable in how to use vaccines and how to account for them. We have also designed forms where when someone receives the vaccine, you'll have to take special information and so forth. So all those books and forms and everything else has been designed. And we are now in the process of printing them. The vaccination card that somebody would receive, those are also completed, and those are going to the printers shortly. So pretty much we are ready, in a sense. What we'll be waiting on now is for us to access the vaccine from COVAX.
Okay, Minister. Now, wrapping up, I know that Qatar will be sending some field hospitals to Guyana to support the fight against COVID-19. And I understand that they will be here tomorrow. Am I correct?
Well, as you know, sometime last year, late last year, His Excellency President Irfan Ali and His Highness, the Emir of Qatar, had some discussions about our bilateral relations. And among the things that were discussed is how issues relating to COVID-19. And Qatar has pledged support to the government of Guyana in its response to COVID-19. And one way in which they have responded or have agreed to help us is to provide a field hospital to us. That field hospital would arrive in Guyana during this week. We were expecting it tomorrow, but I think it has been delayed because you would appreciate the distance from where they're coming, and they have to, they're coming with a special flight to bring that hospital in. The hospital would be able to accommodate about 60 beds, and it has all the necessary equipment for critically ill patients. So we are expecting that hospital to come in, and once that is in, we'll be able to set it up, and so that would increase our capacity to respond to spikes.
Okay, so it's just one hospital is coming in. Can you say what service, you said it will service critically ill patients. Can you say what services exactly?
Well, these hospitals, they'll have the beds that you would require for COVID-19 patients. It would also have things like ventilators and monitors so that we can, if it's necessary to intubate someone, that we'll be able to do that. It would have all the necessary equipment to assist somebody who's critically ill.
Okay, and can you say which region this hospital will be set up in?
We're looking at Region 3, and we'll be establishing it within the compound of the West Demerara Hospital.
Okay, Minister, thank you for that, and thank you so much for your time today. This has been DPI's COVID-19 update. For more information, visit our website dpi.gov.gy or our social media platforms.